What's up, YouTube? You already know who it is. It's your girl, Super Blessed, and you gotta know that I'm back with another video. So today's video is just gonna be about what I go through as a diabetic mother. So you have three types of diabetes. You have type 1, type 2, and gestational diabetes. Type 1, which is what I have, is also considered to be juvenile diabetes, which you can get it when you're younger, but it's also something you can get whenever you're older as well. Type 1 essentially is considered to be insulin dependent, which means your body does not produce any insulin at all, and you are completely dependent on insulin. You know, you see people probably take shots. That is the only way that their body can regulate their blood sugar. And then there's type 2, which you'll see more in people who are obese or who are older. And if you are older, it's just something that happens when you're just becoming older. And type 2 can be reversed if it is due to you being obese. But as far as old age, that is just your body running out of its good stuff. And there's gestational diabetes. Gestational diabetes is what you get when you are pregnant. The reason why most people tend to get diabetes due to pregnancy is because your placenta is fighting off and resisting some of that insulin due to its production of estrogen. You know, it's getting, all these hormones are being released in order to carry out a full healthy pregnancy and to produce milk. So you have all these different things that are changing your body, and for the most part, the placenta is rejecting some of the insulin. So most of my conversation today is going to be about a person who has type 1 diabetes, and that is just my full experience because that is what I am experiencing. So without further ado, we're going to jump into this video. But before we get into the lovely details of being a type 1 diabetic while pregnant, I need you guys to do me a couple little things. I need you to hit that like button so I know that you've watched this video and that you were interested in what I had to deliver to you guys. And then also subscribe to my channel. If you are not yet part of Blessed Gang, what is it that you're waiting for? Don't wait no longer. Go ahead, hit that subscribe button and be a part of Blessed Gang. There's nothing but good energy going on over this channel. If there's any other questions, please don't hesitate to drop them down in the comments below, and I'll be sure to get back at you and let you know everything that I could tell you about being a diabetic. If there's any questions or anything that I didn't answer throughout throughout this segment. So now let's get started. I'm just gonna make this a short discussion about when I was diagnosed and get more to the pregnancy part. So I was diagnosed at 15. I'll do another video about that whole thing, but I was overall diagnosed at 15. So prior to being pregnant, you want to discuss that with your doctor if you're trying or wanting to become pregnant. If that is the case, your doctor is going to want for you to have consistent blood sugars that are in a normal range. Your A1C, they want it to be in a healthy range as well, so that you are in the practice of caring for yourself in a diligent way to where your baby can sustain a healthy life. One thing you'll notice is if you're a type 1 diabetic is that you're going to have lots and lots and lots of appointments. You will be considered high risk, and with my process, with me being considered high risk, I see my regular OB, but I do see specialists who specialize in moms who are diabetic. So they are closely watching my blood sugars. I report my blood sugars. I have to write them down and I send them in to the office every week. And every other week, I go and see them physically in office. They will adjust your insulin regimens only if they feel it's necessary. They will also give you healthy tips on what you should do if you are pregnant, what you should eat while you're pregnant, and there is going to be a lot of a diet change. They prefer your blood sugar to slightly elevate so that the insulin is intersecting and causing a slower peak rather than a steeper peak of your blood sugar, and then the insulin kicking in and then going down. And so then you're in this wave of up and down, up and down, up and down, because you're trying to correct. One thing that has changed besides my insulin regimen, because I normally take my 24-hour insulin at night or once a day, is the fact that they have me take it twice a day. As I mentioned before, your pancreas is resisting some of that insulin, and because it is doing that, you are going to notice that you may need more insulin throughout the day, and they're not quite sure if the 24-hour one is lasting a whole 24 hours. Therefore, they're going to split it up. Possibly, this is all the things that my physicians have done for me. They will possibly split it up to where you're taking it twice a day, but in smaller regimens. At this point, my human-log ratio, the one that I take for meals throughout the day that works over the course of 3 hours, that insulin regimen has not changed at all for me, and my body is doing fine at that regimen right now. They do have me at a point where I am closely watching my blood sugars. If you weren't taking your blood sugars as often before, you're going to want to now. So at this point, I'm checking my blood sugar quite a bit. I'm checking it right before meals, and I'm also checking it first thing in the morning, which is my fasting blood sugar. They're wanting that to be at 95 or below. You are not supposed to correct your blood sugar if it is not below 60. Normally, they want your blood sugar before pregnancy to be 70 and 120, but now it's 60. So that was an adjustment too, to allow myself to be okay being that low. And then I'm checking my blood sugar an hour after every meal. And so for that, they don't want it to be over 140. And then I'm checking it at night during bedtime. There is a time period where I will have to check it between 2 and 4 o'clock. And that's possibly if I do begin to have problems whenever I wake up, or if I'm having issues with a high blood sugar in the fasting period. There is more of a strict regulation on the carbs that you should intake and the things that you should eat. They are more strict on that. They're not really like, oh, okay, it's fine as long as your blood sugars are staying within, a good A1C range. They are wanting you to diet a little bit more and just watch the things that you eat so that you aren't at a high level consistent before you are able to intersect. So you have those fast acting carbs, which we learn about, especially when we have low blood sugars. We learn about those because we're like, okay, we want to correct as soon as possible. We want to feel better as soon as possible, because anyone who has had a low blood sugar knows how terrible that can feel. So those are the things you kind of want to stay away from, because they are shooting your blood sugar up and up before your insulin is even going to intersect. And then that time period, the baby is receiving that sugar and its pancreas is working and working and working as well. So you want to protect the baby. You want to make sure that the baby is not overworking its own pancreas either. So there are lots of complications that can come with being a diabetic mother. When having diabetes during pregnancy, it is very crucial for you to maintain a very healthy blood sugar. More than ever, your body is your baby's environment, so therefore you want to keep it sustained and maintain the best that you can. Being a diabetic, as we know, is not easy, but when you do make the choice to be pregnant or get pregnant, you have to make sure that it is safe. So if you do have diabetes, or if you do have gestational diabetes, at some point there will be a course that you will possibly have to take depending on your physician in each state. But I know I had to take it when I discovered I was pregnant, and it was a 2-hour course. It ended about a half hour sooner because I was already a diabetic and already had been diabetic for 10 years at that point. Most of the things she was introducing to me I had already known, besides the actual physically impact on the baby. Those things like that were new to me. So I have my notes here, and I'm going to just go over a few complications that could happen if you do not regulate your blood sugar as best as possible during pregnancy. So when you are the mother who are carrying, you can have several different difficulties. One being, you will carry a large baby. The baby will be large because there's so much excessive sugar glucose that is within the baby. And we already know what excessive sugar does for a person. It enlarges them. It makes you pretty big. And because of that, the baby will be big. You will possibly have a big baby. And you may have heard that plenty of times. The mom will get big, you will carry a big baby, and all those things. And those are 100% result of having poor control of your blood sugar. Number 2, there will be an increased chance of having a C-section. So the mom would possibly have a C-section due to them carrying a big baby. The baby will be too big to fit down a vaginal canal, or the fact that you will have other health risks to where you will need to have the baby as soon as possible. So 9 times out of 10, it is due to the fact that the baby is big. The baby is big, or the baby is under some physical stress, or no amniotic fluid. Those type of things that are going to cause danger. Another thing is having excess amount of amniotic fluid. These are all things that are due to having a high blood sugar. Preterm labor, the baby would be really big, causing you to have a lot of pressure on that. The baby will be like 10 pounds at 8 months or 7 months. The baby would be the weight of a full-term baby. However, there is a lot of underdeveloped internal organs, and then here you are pushing out a healthy sized baby, but because it is still essentially preterm, there's a lot of internal problems that are going to go on because the baby was born too soon. There's also the risk of bladder infections or kidney infections or any other type of vaginal infections that would happen because you are not properly taking care of your blood sugar, and you are in a more increased chance of that happening when you are pregnant. We already kind of tend to have that type of risk, infection type of risk, because we are diabetic and our immune system is a little bit more compromised. Moms are more susceptible to having and retaining different types of infections. Another thing is toxemia. This is possible when you have high blood pressure, which you probably have heard of preeclampsia. That is where you will have high blood sugar, you will have a lot of swelling, and that will cause you to be bedridden. But the toxemia is when you will have protein in your urine, and that is not good at all. What also goes a little bit hand in hand with having a big baby because of your high blood sugar, you will excuse me. If the baby is big, due to you having high blood sugar, the baby will start to store a lot of that excess blood sugar effect and fat in its shoulder blades. So while giving birth, if you were to have a vaginal birth, and even possibly during C-section, because there is a lot of fat stored in the shoulder blades, the baby will have the chance of having its shoulders dislocated during birth. And I don't want to scare anyone, but your baby it's also easier for a newborn to dislocate certain things because it's not yet positioned and fully formed. However, that is the cause of you having poor control of your diabetes. Not to take it too lightly, but not to be too afraid to where you are freaking out. But just to understand that you really need to take care of yourself because these are the possible effects. If you're having consistent high blood sugars, your baby's pancreas is constantly pumping and pumping and pumping and pumping insulin too to try to regulate its own blood sugar. So another effect of your baby being born with a mother who has high blood sugar is that the baby will come out with this pancreas constantly pumping and pumping and pumping blood sugar or insulin instead of regulating it at a normal rate. It's going to be constantly still pumping as if it was inside of mom's belly. Those type of things will result in the baby being in the NICU, being closely monitored so that it's not having these excessive lows. This also goes hand in hand with having the baby early. The lungs can be underdeveloped because you had the baby early. The lungs are one of the last things to begin to develop, so you will cause the baby to have underdeveloped lungs. Being stillborn, that is one thing as well. If the baby is stillborn, that means that it came out not alive. And that would be because its body was just under a lot of unhealthy stress. You know, we can even die from diabetes complications. You have a jaundice. Jaundice is the result of the kidney failure or liver failure, which some babies do come out jaundice because it's still the levels, the bilirubin, all that is still trying to work. It's using the bathroom and all this type of things like that. So it's starting to work anyways. And that is the yellowing of the skin and the eyes and under the nails. So that is what jaundice appear to be on the outside. That is briefly how high blood sugars will affect your little one if it is poorly controlled. I don't want to scare anyone. However, it is a serious thing, and if you are pregnant and you do have diabetes, it is important for you to take it seriously and to do the best that you can regulating your blood sugar. If you are new to having diabetes or you're just not the best at caring for your diabetes, then there are a lot of specialists who will help you, and hopefully you have the insurance that will also help you as well. There are different types of what am I trying to think of? There are different types of gadgets. I guess I'll say gadgets because I'm having a brain fart. I'm having a mommy brain moment. There are different types of gadgets that you can use. There is the pump that pumps the insulin. However, it doesn't pump it automatically. You do have to key in what you need, but you're not constantly having to draw it up and stick yourself. And then there's also a constant glucose monitor where that is in the back of your arm, and well, that's the general placement I've seen, is in the back of the arm, and you can just put your phone up against it instead of pricking your finger 7 to 8 times a day and trying to figure out what your blood sugar is. So I think those things are really helpful for people who struggle with taking the time out, because it is a good 5 minutes before you eat. You have to deal with something, and it can be a lot. You have to check your blood sugar, and then you have to give yourself insulin. And it is a lot at times, especially if you lived a long life without diabetes. Or even if you've lived a short life, and you have had diabetes for quite some time. You get tired of it. I personally have not had those moments, and I thank God for not having those moments, due to the fact that I do notice right away how I'm just like, it doesn't, I'm like not feeling well, and I just don't want to put myself in a predicament that's worse than what it is. So I've been blessed with a lot of acceptance, and I accept a lot of the things that come my way. Diabetes tend to be a genetic thing, so if you do have it, there's probably someone else that have it, and you just gotta think of the little one and think like, okay, this is all for my baby, and I just want it to be healthy. That gotta be the moment where you're like, okay, I know it sucks, but I gotta love my baby a lot more too. And so, not that it happens, but I want my ladies to try their best and try their hardest to make sure that baby comes out healthy. And don't forget or be afraid to ask for help. You need it. There's lots of physicians that are there to help, and that they understand that it is a struggle being a diabetic, let alone being one that is pregnant, So, and if there is some type of missupport, like you don't feel supported by your physician, change the physician if that is a possibility. I am very blessed to have a great team behind me, and I'm super excited, and I love the physicians that I work with each and every week. But the bigger thing, the big picture here, y'all, is to please, please, please be healthy and be the best mom you can be, because for us, being a mom starts as soon as we are pregnant. That baby is with us the whole time. So be a great mother and make sure that you are giving it the best type of health as possible. Otherwise, it may cost not only the baby, but it may cost you a little bit too. So I think that covers it all. And like I said, if there's any questions, please don't hesitate to drop them down in the comments below. If there was anything that I didn't make clear enough, please be sure to ask the questions. I really appreciate you guys watching. And until next time, thanks, and be blessed, you guys. Take care.